My name is Jeffrey Tomaszewski, and I'm the Associate Program Director for the Urology Residency here at Cooper University Hospital, and the Director of Genitourinary Oncology at MD Anderson Cancer Center at Cooper. We are really thrilled to have you with us today and excited to share the many nuanced benefits of our training program with you. We have a very high surgical volume of training for our residents, especially in endoscopic and minimally invasive laparoscopic and robotic procedures. One of the nice things about a small program like ours with one resident a year is you don't have to compete with fellows for cases. They're cases you participate in fully and get early and graded autonomy commensurate with your level of training. I think this is a great benefit of our program here at Cooper, and one of the reasons our residents come out trained so well to handle the entire breadth of urology. Another benefit of training at Cooper speaks to the topic of mentorship. I think as you're looking for a program and deciding what's important to you for your future and your career, think about the people you're going to be working with and how they will train you. In a small program like Cooper, it's a great advantage to our trainees as we really develop one-on-one mentorships with each resident throughout the entirety of your training. We get to know you very well, better than we know some of our children, in fact, and we get to spend a lot of time together. And we really revel in that time and love to watch how you grow throughout your residency and go on to be successful urologists. So I think in a program like this, there's a lot of one-on-one mentorship with attendings, and really we sort of get to help groom every one of you for a successful career. One of the unique aspects of our program I'd like to share with you is our relationship with the MD Anderson Cancer Center in Houston. Through this relationship and partnership, we have developed a robust and high-volume robotic urologic oncology program. What this allows for you as a trainee is exposure to the most complex, minimally invasive oncology cases in urology and an extremely high volume of said cases. We have a unique setup here. We have 2 separate robots as well as a robotic simulator. So before you ever sit down at the robot working with an actual patient, you're on the simulator learning how to move the instruments and to control the robot effortlessly. Once you're in a position of actually operating, we have dual consoles so we can do the cases together. And I'm able to take you through the cases in a graded fashion commensurate with your level of ability. And as you progress, I really view our residency as a mini fellowship for our residents, and I think they would tell you the same thing. You don't compete against other fellows in our program for operative time, and when we do our robotic cases together, by the end of your training, you're doing most of them by yourself with my direct supervision. So I think our robotic program and our volume is really outstanding in the whole range of oncology and complex reconstructive urology procedures. As well, I think from a standpoint of wellness, it's something we at Cooper and in the urology division take very seriously. We hope all our residents and help to integrate time for you to have protected time in your schedule to stay well. I think this is a very important part that you start early in your training. So as you go on and become more of a staff physician, you won't have to worry about how to incorporate time for things that help keep you well. So at Cooper, we have a program that is run by our GME that helps to promote wellness among our residents, hosting many events throughout the years, as well as a very tight esprit de corps among our residents. And I think when you meet them and speak with them, that'll be self-evident. Finally, I'd like to just talk a bit about the training landscape here in South Jersey. For those of you not from the area, we are in close proximity to Philadelphia, a major metropolitan area, and a number of other training programs regionally. However, in South Jersey, we are really the only academic tertiary care medical center in quite some distance. So we have an outstanding referral base. We have a wide breadth of places for you to live as a resident, whether it's in the city of Philadelphia or more of suburban New Jersey. I think the South Jersey landscape, both from a practice standpoint and a quality of life standpoint, is really outstanding. You're connected to the rest of the Northeast Corridor, and I think we have great affiliations with the other programs in the region, especially in urology. As part of the Philadelphia Urologic Society and as active members in that organization and as the current president, we are well integrated into the other programs in the region for your colleagues for you to work and train with throughout your time here at Cooper. Again, we really hope you consider us seriously. We really look forward to meeting you and hearing more about our program in person. Take care.